Hello and welcome. I'm Pater Nuez Makel. This is Rappler Talk. Singapore has experienced a surge in COVID-19 cases for the past few weeks. Many or most of these are from workers' dormitories. From being a gold standard in managing COVID-19, what happened to Singapore? To help us understand this issue, we have with us Alex Au, the Vice President of the NGO Transient Workers Count 2. Thank you very much for joining us, Alex.
You're welcome. Nice to be here.
Alex, can you give us an overview of the problem?
Well, yes, Singapore is now becoming quite famous for all the wrong reasons, mostly because the COVID-19 cases have simply exploded in the migrant worker dormitories. In a way, we kind of like saw it coming, but we ourselves didn't realize how bad it can get, and it is bad. It's really right up there. Now we are reaching 16,000 cases as of today, and that's a lot for a small country with only 5 million people. So what has happened is that during the first 2 months, February and March, most of our cases were among citizens and tourists and Singaporeans coming back from Europe, from Australia, and from China. So they were quarantined. They were easy. The contact tracing was easy because they were relatively few in numbers. When the first cases began to emerge from the workers' dormitories, the transmission was very fast. So all of a sudden, it was a totally different gradient of a curve. It just changed. It just went straight up like that. And that is largely because in our workers' dormitories, the men are housed in very close proximity. Typically, a room might have 10 workers there, 15 or 20. And the beds they're usually double-decker beds, and they are 1 meter apart or even less. So obviously, you can imagine transmission would be very rapid. And in our view, our government's kind of like lost control of the situation. They tried to lock down the dormitories, but you know what happened? When you lock down a dormitory of like 5,000 or 10,000 people, it's like locking down a cruise ship. Remember cruise ships, right? So you confine your passengers in the cabins. And I'm sure Filipinos are familiar with cruise ships because so many of your nationals are seamen. You lock them in a cruise ship between the ill and the well next to each other, or rather next room, and even though you lock them in the room, it's still incubated and spread. We saw that in so many ships around the world. Now, in cruise ships, you have 2 persons to a room or 4 persons to a room. In dormitories, we have 10 people to a room, 15 people to a room. So it's like, cruise ships times 10. And no wonder it spread.
As a foreigner in Singapore, I had the impression at first that Singapore was very well prepared to face COVID-19. From the SARS experience in 2003, the systems have been in place for a long time. How did this happen?
We will say that the systems in place worked for the Singaporeans. There has been decades of neglect of the migrant communities in Singapore. There is a tendency among our policymakers to only think in terms of the Singapore citizens when they plan programs or social welfare systems or all sorts of things, from career training, career upgrading, and everything. It's always planned with a Singaporean in mind. And the migrant worker is usually left to the mercy of employers. Mm-hmm. Singapore adopts the policy that the government is responsible for citizens and employers are responsible for the non-citizens. We adopt a policy that the government did choose to bring the people, the foreigners into Singapore. It's the employers who chose to bring the foreigners into Singapore. Therefore, the employers are responsible for whatever social safety net and whatever arrangements need to be made. The trouble is that in a public health emergency like that, employers are in no position to do anything. That's not their business. They have no experience doing it. Actually, even the government doesn't have experience doing it because this is a much bigger infectious disease than dengue or measles or chickenpox and all that kind of thing, or SARS even, in terms of numbers of infected patients. So that pattern, that neglect, that failure to plan, to think about how it will affect a migrant community made it so much worse. Because migrant communities have very different circumstances. I've already described this, for example, that they live in very crowded accommodation, but also they have no savings. The low-wage ones have no savings. The Singaporean family has savings. If one member gets sick, you have another family member who's able to run around and help. And but if one migrant worker gets sick, he has no family there. So they have very different circumstances. Yeah, and unless you plan especially for migrant worker communities, the plans that you make for Singaporeans cannot apply properly to them. And I think that is a big reason why Singapore looks so unprepared when it hit the migrant communities.
So what is the ideal situation, Alex?
Well, the ideal situation, firstly, would be to reduce the vulnerabilities of our migrant communities. And that is not just a matter of housing, okay? They need, I would think they definitely need better salary security. They need better access to medical care. They certainly need freedom from recruitment fees. Because, let me give you an example. Let me digress a little bit. Because they have paid so much for their jobs, they cannot resist any unreasonable demands from their bosses because they don't want to lose their jobs. So when a boss says, I don't care how sick you are, you have to show up for work, because if you're absent from work, I'm going to dock your salary and I'm going to impose a fine for absenteeism. So when workers are faced with this kind of thing and they dare not displease their boss, they will go to work even when symptomatic. And in fact, that was how some of the cases spread, not at the dormitories, but at the work sites, which tells you that symptomatic workers were still going to work because they just couldn't take the day off. So this lack of empowerment of workers is a direct cause of some of the infections. So when you ask what needs to be done, well, we have to address all these issues that disempower workers. We have to address all these issues that make them so extra vulnerable. And so it's going to be a lot of work to be done after this pandemic.
I'm aware that your group wrote an open letter to the Singapore government a few weeks back, right? Right before the outbreak in the workers' dormitories began. Can you tell us more about this open letter, this warning? How else did you warn the Singapore government about this outbreak in the dormitories?
Yes, we did write a letter. That was in March, before the clusters developed in the dormitories. And we pointed out that there are certain risk factors which are unique to the migrant community that Singaporeans may not be aware of. We were very concerned that because they were unique to the migrant community, we were not making any plans for these emergencies. And I think we were proven right. The first was crowding in the dormitories. And the second was crowding in the transport. When they were brought to work in the back of trucks, they were kind of like sitting together, almost like cattle, all right, very close distances from each other. And the third was that they were always afraid to take medical leave because the bosses would be very angry with them and might cut their salary and they might lose their jobs and that kind of thing. So we highlighted these three dangers, and we also said dormitories could be like cruise ships, which by then we already knew were very dangerous places to be in when an infection has started.
So how did the Singapore government respond to your open letter?
Here is the thing. They don't always respond directly to us. That's not the way the Singapore government works. But we made certain suggestions in that letter and in some subsequent articles that we published on our website, when we suggested that the first thing to do is to achieve real, meaningful social distancing in the dormitories. That meant we would have to move people out into temporary alternative accommodation. We suggested army barracks. We suggested car parks that be converted into emergency shelters. They won't be comfortable, but it'll be okay for a short period, 2 weeks, 4 weeks, something like that. Stadiums, sports stadiums, auditoriums, and so forth. So the government did take some measures. They did act. We have moved people into barracks, into car parks, into sports stadiums and auditoriums. But they did it in a much smaller scale than we expected. So even now, they have moved only about 10,000 workers out into temporary accommodation, out of 300,000 in the dormitories. That's like 3% of 300,000. That doesn't make any effective difference to the density in the dormitories, which kind of explains why it continued to rise and continued to rise. You see, so yeah, not enough. I mean, like, too little, too late.
Too little, too late.
Mm-hmm.
What do you think does this say about Singapore as a society?
I think, like all these things, there is a reluctance to believe that it can get as bad as it will get. All right. When your infections are at 300 cases, it's hard to conceive of 10,000. It's a totally different order of magnitude. And like so many governments around the world, they tend to lag behind a certain reality before they react to it. So I think the Singapore government is no different. I mean, despite all the claims of being, world-class and all that, I think there are weaknesses in our governance system, which this incident, this event has obviously shown up.
So what happened? Did Singapore forget? Did the Singapore government neglect the workers or abandon them? What's the right adjective to describe what happened?
Confusion.
Confused. Why
confusion? Yes. From the way we saw the reaction, it was in bits and pieces all over the place, and the responses were kind of changing every 3 days. Statements were being issued, advisories were being issued, and the second one contradicted the first one, and so on and so forth. Basically, it showed a lack of preparedness. As I explained earlier, the lack of preparedness was simply because for so long we just don't have a habit of thinking about the migrant worker as a separate and vulnerable community with its own circumstances. So we just don't have the habit of planning for them. And so when the virus hit, and of course it hit very badly, and because of the crowding, the graph went off really steep. What we saw was very uncoordinated measures, a lot of demands being issued to private parties to do something. Employers must do this, the dorm operator must do this, employers must do this. But these people just aren't set up to do these kinds of things. Or you cannot all of a sudden say employers must provide food, because all along employers have never provided food, and then where are they suddenly going to get 3 meals a day, within 2 hours notice? So that's the kind of thing. And then we also have a lot of stories coming from the workers about lack of medical care. They are not down with COVID. Our organization helps a lot of injured workers, people who have been injured at work accidents, which therefore take some time to recover. So they've been injured and they've been needing medical care pre-COVID. But when the lockdown happens, right, they have, what's going to happen to my follow-up appointment? What happens if my prescription runs out? How do I get a new prescription when I'm stuck in the dormitory? You know, who do I call? I mean, that kind of thing. So even until now, it's still chaos in some respects. It varies from dormitory to dormitory. Some dormitories got their act together. Some dormitories are still struggling with it. So yeah, it's not a pretty picture.
How would you describe the way Singaporeans treat migrant workers?
Singapore is a place that is actually very used to having people from different national origins amongst us. All right. So on the whole, Singaporeans are very understanding of the role and the essential role played by migrant workers here. And on the whole, there hasn't been a lot of xenophobia. This is not to say that it doesn't exist at the margins. It does. We do have people saying very nasty things. But I would say that on the whole, they are a minority opinion. And very quickly, you will find somebody else saying, hey, that's the bad thing to say. That's a completely unfounded thing to say about a foreigner. The other measure of it is that since the crisis started, our organization has had an outpouring of support and donations. So that basically will tell you where that center of gravity lies in terms of Singapore's opinion.
How did migrant workers help Singapore get to where it is now?
Oh my goodness, we can't be where we are now without migrant workers.
Why?
Let's be, you know, I mean, we're all migrant workers or descendants of migrant workers. Singapore was mostly uninhabited 200 years ago. And so, like I'm of Chinese ancestry, so, my forebears came from China. So just about everybody in Singapore is a migrant or a descendant of a migrant. Obviously, as always, you could be a descendant of a migrant, but you say, I'm Singaporean now, and that guy is the outsider. That can happen. And it does happen, unfortunately. So everybody has played a part. Migrant workers are essential because Singapore tends to have more jobs than we have people. We have a very low birth rate. We just don't have enough people. But our economy has for 2 generations been good enough to create so many jobs that obviously we need to have migrants to fill those jobs. Anything from doctors to nurses to construction workers to truck drivers to engineers, graphic designers, and so forth.
Zooming into the Filipino community, what are the challenges faced by Filipino workers in Singapore?
In some ways, the Filipinos fit in very well. In other ways, they get singled out, mostly because the Filipinos, many of the Filipinos were in Singapore take jobs that Singaporeans may believe rightly belongs to them. You see, it's not like, say, the Bangladeshis or the Burmese so much, or the Indonesian domestic workers. They do jobs that Singaporeans don't want to do. So there isn't that sense of, sorry?
Like what? Like what?
Well, like construction work, blue-collar work, domestic work, sanitation work, all right? Singaporeans don't want to do those jobs. It's considered dirty, dangerous, and demeaning. 3Ds. But Filipinos take all sorts of other jobs. The architect, as I said, the web designer, banking, nursing, and therefore, in that respect, they face the understandable sense of Singaporeans that you're taking my job away from us. Okay? So they get that kind of reaction, which other nationalities do not often get. The Chinese migrants also get that reaction because they also do the same kind of jobs. The Filipinos do these different jobs, including white-collar jobs, and they get that reaction from Singaporeans. A kind of envy, a kind of, sense that you're taking away my rice bowl, so to speak.
Uh,
Yeah.
yeah, is this affecting in any way the way Filipinos are being treated now in this time of pandemic?
I don't think so. I don't think, I think the topic of conversation has changed so much. Everybody's talking about the virus. Nobody's really talking about anything else. So this is not an ongoing meme right now, but it is going to be an ongoing meme, for a long time to come, because even after the pandemic is over, Filipinos will continue to do the jobs that they come here to do. Their bosses will certainly welcome them, but other Singaporeans might feel that they're competition.
Are there
So
Filipinos who have approached your NGO in recent weeks or days in relation to COVID-19?
not in relation to COVID-19, but even pre-COVID, we've always had a number of Filipino clients come to us. For example, somebody working in retail, somebody working in physiotherapy, and we've had bartenders come to us. And they have the same problems that other migrant workers have. It's like unfair terms of contract, premature termination, non-payment of salary, that kind of thing. So we'll continue to have that. I mean, these things don't disappear just because COVID has come.
Zooming out again, Alex, and wrapping up, what do you
Sure.
think can other countries learn from the experience of Singapore now, where we have a rise in COVID-19 cases in workers' dormitories, and there's what you observe to be a neglect of migrant workers in the country?
Well, very simply, one has to look at these neglects and do something about that. And the neglects are not just in terms of housing and dormitories alone, although there will be a tendency of some people to keep the conversation narrow to just dormitories and housing. I think we also need to address the other vulnerabilities that stem from low wages, unfair employment terms, recruitment fees, for example, which disempowers them so badly, access to medical care and other income support should they be laid off. Uh, so these are the issues that really all need to be addressed because, yeah, right now, the crisis came from the housing vulnerability. Who knows when the next crisis is going to come from some other vulnerability, right? So better, here's a lesson. Don't neglect a migrant community.
Anywhere in the world.
Anywhere in the world. Yes, exactly. Because you need them. That's why they're there. Okay, and they can be a major embarrassment if you ignore them for too long.
How would you assess the way Singapore has handled COVID-19 in general?
Oh, that's really that difficult because we seem to be so schizophrenic about it. In terms of handling it for the Singapore citizens, our figures are very good. We are now down to 10 new infections a day, which is really, very, very low. But then, so the systems worked for Singaporeans, but the systems didn't work because they were the wrong systems for migrant workers. Telling them to social distance is meaningless when they are living 15 people to a room. So there are good lessons to be learned and bad lessons to be learned.
Thank you very much, Alex. We've been speaking with Alex Au of the NGO Transient Workers Count 2. I'm Paterno S. Makel. Thank you for joining us.